And I want to transition into a broader discussion with all of our panelists. And I know some of you want to ask more questions, and we will certainly make sure that those questions get answered as much as we possibly can. But in transitioning to all of our panelists, one of the things that Dr. Bigfoot talked a lot about was mentorship. Dr. Nguyen talked a lot about shared experience as well. And I think those are two major factors as relates to the success of those going into the field and those remaining in the field. And I was wondering if our panelists, if you would talk a little bit more deeply about the issue of mentorship and what that has meant for you and what that can mean for others in the field.
First.
Oh, I never know how this works.
It's on.
It's on.
Oh, it's on. Okay.
You're good.
Okay. You know, technology was never what my desire was, but I had applied for many PhD programs, and due to a variety of things, I got rejections from all of them. And this is a side, one of the joys I have is when I go to the University of Michigan or University of, San Diego, wherever, I can say, you rejected me, you know. That's the fun part about it. But when I got into I graduated from the University of Oklahoma Counseling Psych program, and my advisor was and continues to be Wayne Rowe. And one of the things he told me was, we selected you to get into the program, and my job is to make sure that you get out successfully. And I think that he articulated what was for me a message that I would carry forward with all of my students and anyone else that I encountered, was that my job is to make the pathway as successful as possible for you, so that you can achieve as much as you possibly can.
I'll jump in. So I think in speaking about mentorship, I think of some conversations I have with current fellows as I try to have them assess what their mentorship needs are and how we might be able to supplement that mentorship with our career mentoring program. And so, there are fellows who say, "Oh, I need help with a technical task piece, like more experience with writing papers or writing grants and that type of thing." But I also hear a lot from the fellows, an African-American male who says, I need to know, I want to go into the academy, I want to be able to rise through the ranks and do my research in that setting. I need somebody who's walked that path. I need to have that African-American male. And then I've had that with Native students as well, where Native doctoral students will say, I have a mentor who's great, but he doesn't understand what it's like for me as a female Native and what I can and can't ask for. And so I'd like that piece. And so I think that gets to that flexibility and that depth of resources to be able to say, if that's what you need, we can match you with this individual or that individual to try to maximize that experience.
Years ago, I used to do a workshop that looked at independence versus interdependence. And one of the things I used to do as that workshop would begin, I'd ask how many people want to be independent. And I'd see all the hands go up. And that's kind of like mentees who are trying to find their own place. And I'd tell them this story. And I'd say, okay, everybody that has their hand up, take off everything you didn't make. The point being is that we all need somebody. And so I normalize and make it okay for people and my mentees to recognize it's okay to need somebody. It doesn't make any difference whether you're fully licensed, you got a PhD, or who you are. We all need somebody. And that we work better when we're interdependent. I need you as much as you need me. The mentor needs the mentee just as much as the mentee needs the mentor. And if they work together holistically, they can both gain from the experience. I think that mindset helps recruit both mentees and mentors, that both people have something to give and both people have something to receive. And when we work with our mentees, we always win. The profession wins. But we have to normalize it. And I think that becomes extremely challenging in today's society where we have a tendency to isolate, either because of technology where we don't communicate directly with one another. We shoot 140-character text across that we think explains everything we want to say. And then when we can't say it, we say what? It's complicated. So what we have to do is normalize the relationships again, so that people really feel comfortable. It's okay for me to meet somebody. It's okay for me to connect. I have mentors now who are 15 or 20 years older than me. Why? Because they've been where I'm trying to go. And that is the benefit of the learning experiences. I don't have to go by myself. And the path is already made. I don't have to create a new place, even though I find or create a new space.
Excellent. Thank you. Are there any questions, sticking with this topic of mentorship for a moment, are there any questions or comments around mentorship? And if not, Dr. Horn would like to say a little bit more around diversifying faculty. So,
Oh, thank you.
Yes.
Yeah, that came to my mind because I think that's a challenge because that was brought up. Because I was just reading something about that. This was specifically about African-American faculty. And it was talking about the number of African-American PhDs has almost doubled, I think, in like the past 20, 30 years. But the faculty ratio is still only 1.8%. And that's a real number. And I was thinking, how in the world is this the case in academia? That even though the numbers are growing for not only African American, but for other minority faculty members, the actual people working in academia who are people of color has barely budged. And people look shocked when I say that, but I say those are the numbers that are recorded. We have to look at the systemic issues. And it's one of the things I try to let people know when they talk to me about, well, what university should I go to, or looking at these opportunities. I always say, where do you feel comfortable, where you feel acceptable, and always check the tenure ratio. Find out who's being tenured. Because just because people are trying to recruit you, sometimes they're trying to recruit you because they need a minority faculty member. But stop and look at how many minorities at that university are actually getting tenure, because that's where the rubber meets the road. And otherwise, you see people just circulating. And I've seen that with a lot of minority professors. They just circulate. They go somewhere 4, 5, 6, 7 years, and then they find out, well, they can't get tenure for, some subjective reasoning. And they have to go somewhere else and start all over, because those years aren't transferable to other institutions in many cases.
All right. Thank you very much. And now I will open it up for any questions or comments that you have for any of our panelists or all of them. Yes.
I do have a comment. My name is Lynette Wolford from the National League for Nursing. And this is for any of our panelists. As we talk about, I can't help but always feel when we talk about social determinants of mental health that we focus on these determinants as they relate to patients, right? I mean, of course, that's relevant. But I find in my daily experiences, locally and nationally, that the mental health of the practitioner, some of our practitioners are not mentally healthy. How about that, right? So we are talking about a workforce sometimes who have our own biases, ignorance, mental health concerns that we're not addressing, but expecting them to address this with others. So can you speak to that concept? Is this something that you see, and what are your thoughts about that?
Oh, I don't mind going first. I mean, I'm looking around. I think that is a concern, not only for mental health counselors, but for everyone in the helping profession, because we're human beings, and we have to acknowledge our own humanity, our own issues, and our own concerns, and we need to be aware of them. Self-awareness becomes really important, and I think we have to make it okay for people to get help. And for people to acknowledge it, because we talk about the stigmas in all these communities. But, I work with professionals from Medicaid level to professional sports CEO level. And the stigma exists throughout. No one wants anyone else to know they need help. So me as the clinician, I don't want anyone to know either. Because if I do, then people will think, okay, they will label me. So once again, it comes back down, I think, to stigmas, and that we have to make it okay for people to seek help when they need help. And that requires some institutional changes, as well as changing our views, how we see people with mental health illnesses. Because I think sometimes we have a tendency to see them as the disorder. The client is an addict. Like, I hate that phrase. They're not an addict. They're a person with an addiction disorder. They're still, we rob them of their humanity. And we're afraid that if I acknowledge something, I'll be robbed of my humanity. So, but I think we do, great point, great question.
We have a question over here, and then we'll come back to this side.
I certainly appreciate and value each of your stories that you share. Stories are powerful, the narratives. And all of them, you all face challenges or adversities in becoming the person you are today, and you mentor others. But a question I have is, how do you teach grit, resilience, and tenacity? How do you have 4 people lined up, you mentor whatever, and how do you teach the essence of what all of you have in each of your specific stories? How do you help people do that? Because I think that's something that we don't know how to train, but it makes a whole lot of difference in the long-term outcome. And I would really relish your opinion about how do you convey that.
I'll try. I think that's a part of it is affirming the goal, affirming the process, and supporting the individual through that process, and I think that we touched on this idea earlier about instilling hope, and it can always look bleak, and that's where I think having that mentor or somebody who can say, you can stay on this path, this is an okay path to be on, and you'll get through it, and it's more experiential, I think, rather than talking about, that you have to have grit to be able to do it, because it's, like how do you be that gritty person, that gritty player that, like is valued in sports, for example, but encouraging and that perseverance, I think, is part of it.
When historically youth were wondering about how to manage life, one of the things that was encouraged was a vision quest. And it was an opportunity to for introspection. It was an opportunity to sacrifice. It was an opportunity to have some restraint and to isolate oneself and to be more self-sufficient than not. And I think that we still have that opportunity, maybe not as much as it might have been where you're, going on top of, the mountain or going along, some, backwater place and spending time in that introspection. But I think that allowing for kids to figure out how they can do things differently, and creating that space for them to figure out how to do things differently. I ask parents all the time, how old does a child need to be before you allow them to make decisions for themselves? How old should a child be before you allow them to make decisions for themselves? And I actually tell parents they're already making decisions when they're infants, when they're first born, because as they start nursing, they have a preferred side, right? They have they know how to latch on to the nipple, or they want to be laid in a certain way. And so right at the very beginning, you can start helping them with this decision-making process. Oh, you want to be on mama's left side. You're choosing to be on mama's left side. Oh, you don't want to eat now. You want to sit up. Oh, you have you need to be burped, so you want me to sit you up. So this helping to help kids understand what their process is as they go through this decision-making or search or introspection or questioning, that I think that's where we help to have those little bumpers for them so that they can develop that grit and develop that determination. And we keep telling them, yes, keep trying. No, I'm not. I'm here to help you, but I'm not going to help you in that way. You keep trying. I was talking about my little. The reason why my little 6-year-old granddaughter was asking me questions was because she was trying to avoid homework, and and it was like, well, you have this much time, and if you have this much time and you don't finish your homework, guess. What do you think is going to happen? And she goes, I don't get screen time. That's correct. So you're going to, there's consequences to your decision about not doing your homework right now. So what choices do you want to make? So I think, being able to, that's why that decision making is so important, because I think that's where we help them develop that grit, develop that determination, develop that motivation. And so we don't typically send our kids off to do vision quest, but I think in day-to-day opportunities or week-to-week or in any challenges, that can be part of that Vision Quest environment, so that they can learn more about what they're capable of doing and how they can direct their own selves. And along with that, I think is within our tribal societies, ceremony was important for many of those opportunities to take place. So ceremony is about sacrifice and about guidance and about that mentoring. And so as we think about even in our academic settings, ceremony is really big. The white coat ceremony, right? So having that as understanding of how ceremony fits into how we direct our lives on a daily basis, as well as a professional, lifelong desire to accomplish something.
All right, we'll go with Sandra and then Angela.
My question.
Can we use a different microphone? Oh, there we go.
My question is, how do you build capacity to mentor persons who don't look like you?
I was taught that some of us are alike and some of us are different. And in order to make things work well, we need those that are alike and those that are different.
For me, I advocate honoring other people's voices. We don't have to agree on everything, but we can talk about it. And if we can talk about it, we can work together. And I think, once again, the whole aspect of mutual respect, sensitive subject for me because I look at today's world, today's politics, and especially here in D.C. And I think, the breakdown of communication has really hurt. So how do I build that? As people say, relationships are built on communication. Communicate and honor people's voices. You don't have to agree. I don't need you to agree with me. I tell my students, you don't have to agree with me to make an A in my class. You have to be able to represent your position and accurately present it, and present it with scholarly and academic resources. So.
Thank you. Thanks, panel. This is a great discussion. Could listen to you guys for a long time. I was connecting the dots between two things that were said earlier. One was about creating space, and the other was about authenticity. So I'd be interested in your thoughts about the intersection, creating space and authenticity.
I'll address that in the workshop. I think that's what the whole aspect about creating your own space is about, being authentic to yourself, to thine own self be true. And that's where you'll find peace. I'm not going to find peace, and you won't find peace doing something other than you. And no one is going to do you better than you. So be authentic, be honest, be who you are, and then create a space. When I came into the profession, I said, I'm going to do me. I'm not going to I'm going to abide by the ethical guidelines. I'm going to abide by the ethical code. I'm going to get my license legally. I'm going to practice legally. But my practice is going to be my practice. And I have done that. Some people say, well, we don't particularly like your style. Fine. Somebody will. I don't need to have every client. There's 230 people. That I gave you the numbers. And that's one of the things I keep pointing out. I can be me and still have clients. I'm an ordained minister. I have a strong LGBT population. And people say, well, how do you do that? How you pastor the Baptist church. I'm like, well, yeah, but they're people. I'm people. Once again, I have people who are not part of the LGBT community who I don't have to agree with, and I agree with them. I agree with people whoever they are. It's not a matter of whether I agree or not. I'm here to help. And I think that's what we have to do. Put whatever we do aside and work with everybody, treat everybody with a sense of dignity. And so that's what I mean about creating your space. And you create that space for you, not for my colleagues at the table, but my space is for me. And I tell them, you won't find a place, because when you find a place, that's a place somebody has already built for somebody else. When you hire somebody, you've already created the job description. You have already determined what you wanted. I don't need your job. I can create a space where I fit in, where it will be mine, and I will have ownership of it. And that's where I'll be the authentic me. But that's a workshop in itself, so. She has one.
At our medical school, we get the opportunity to have exposure to the residents as they go into different topics. And one of the topics that I have supported is death and dying and grief. And so we have maybe 10 to 12 or 15 residents at a time that sort of go this, rotating. And then we have an agenda that we follow, and it's, like 45 minutes, and then they go to the next one. And so when they come in, part of the guidance is to introduce yourself and to tell, a little bit about yourself and, your exposure to any kind of death or dying experience. And so they go around and they introduce themselves. And then I said, okay, now what I want you to do is I want you to close your eyes, and I want you to introduce yourself again. And that takes on a different kind of introduction. And so I think that when we talk about our authentic self and the space that we create, we have to be comfortable with our own self, and we have to be vulnerable. Because one of the things we do is that when we watch people, we can tell that their reaction to us. But when we close our eyes, we don't know. We can't read what other people are doing and how they're perceiving us. And so being able to create that space and feel comfortable in, or even uncomfortable, I think that's where our growth comes from, is that discomfort. And to know who we are, and that evolving self, and to be able to have that connection because we're in a space. So that is, I think, as we think about authenticity and how we're in a relationship, because that relationship creates a space.
I'm going to jump in because I took your question in a slightly different way, because I think that it can seem overwhelming for programs to think about, well, how do I create spaces? You know, like I have 250 students. Each one might have their own unique needs, and how do I create 250 unique spaces? And I think that that's where we need folks to sort of foster creative thinking about that, to look through from an interprofessional lens, look at interdisciplinary places where there might be overlap, so that we're not so place-based within departments and programs, and also to look at some of the remote roles. We have online communities through our associations and membership groups, and so how do we use that to foster spaces that people can figure out what their authentic self is, because not everybody knows when they've entered any program that we're talking about. And so someplace that they can either, as they're finding their way, or are seeking something out because they've identified a need.
All right, thank you. And with that, we must close, but I want to thank all of you for participating in this and for your rich questions. And let's give a round of applause to our panelists for their great contributions. Thank you very much.
I have
Thank you,
gifts.
panelists. We will now break for lunch, and we'll return sharply at 1:30. Lunch is right outside the doors.